So hopefully now you've seen the up segment, singles on the up, and you know what an up is, okay? And you understand what muscles it requires to make that move happen. Now we're going to talk about downs, okay? And the reason you have to know ups before you can know downs is so you can know the difference, because there is a difference, okay? Ups, downs, okay? So, home position, you should know what that is already. I'm going to take a step back so you can see my feet too. Alright, home position, home posture. I want you to do an up on the right, my right, so if you're looking at me, it'll be your left. Up, right leg straightens, hip bone comes up because the obliques are contracting. Leg straightens, oblique contracts, the hip comes up. I'm trying to pull it into the center line of my body, not out in the space somewhere or into my armpit necessarily. I want it up, like I'm trying to bring my ribs and my hips together, but I'm not tilting my upper body downwards, just the hips working. Up, up, okay, on the left, up, 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 okay? So, now that we know it's our oblique and our leg that is causing this to happen, this is a very basic up, mind you. The glutes can get into it, and you can do it not just for the glutes, but we're not going to go there right now, okay? Don't worry about that. Okay, leg straightens, okay? Oblique contracts. You're going back into a neutral position. Notice as I say, we're doing singles on the up, and I'm saying right hip, up, down, up, down, up, down, up, down. When I say down, talking that respect, I'm just talking about neutral. I'm not talking about down, okay? Because there is a down beyond the neutral point, okay? Whether you know it or not. And how down you can go will depend on, you know, strength, flexibility, all those things, okay? But don't worry if you can't do it big right now, do it small. Just try to get the technique right. Okay, so with an up, we're coming up. Obliques contracting, the hips coming up, the legs straightening, go back into neutral, okay? Now, if you bend that knee more, release that oblique completely, you're going down, neutral, up, neutral, down, neutral, up, neutral, down, neutral, up, neutral, down, neutral. Okay, the reason that there's more of a down is because when you're walking and just standing from day to day, your obliques are active whether you know it or not. Your obliques, your abdominal muscles are keeping your pelvis in line, hopefully, if you're a balanced person. If you tend to stand one way like this all the time, you're probably way out of balance on one side or the other. And you'll notice that when you dance, which side is stronger and which side is weaker. So what's happening is we do the up and we come down to what we think is down, but it's really not. It's just an active, normal state, okay? The obliques are active. We fully release that oblique, boom. That hip can come down further, all right? And the knee has to bend, obviously, to let that hip come down. You want to also make sure, like I said, you're in posture, your hips, your pelvis is tucked with that weight hanging off your tailbone, because you don't want your weight sitting on top of the front of your pelvis, okay? Because that inhibits your degree of movement, all right? So keep that weight kind of back on your heels. A good check is to see if you can wiggle your toes. Okay? This doesn't always absolutely necessary because sometimes we're actually on our toes, but even then you should be able to wiggle your toes. You should not be clutching the floor with your feet, okay? So back to what we were doing. So a down, release that oblique further, okay? Bend that leg more, okay? Back to neutral. Try the other side. Do an up first. Up, neutral, down, neutral, up, neutral, down, neutral. All right, this is the very, very simplest, most basic down, okay? Not necessarily easiest, mind you, but it's the most basic kind of down. Normally, when we dance, you're going to see a little bit different kind of down, and it's what makes a down look different than an up, conventionally speaking, anyway. A down involves a hip slide, a very, very tiny hip slide. So this is why I wanted to make sure that you had hip slides before we move to downs, because here's what happens. All right, if I'm dancing, I can do up, 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 down, 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 down. Okay, now you notice that's different than the ones I just showed you. Okay, the one I just showed you would have been up, 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 down, 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 down. Smaller, not as obvious, it almost just looks like I'm kind of maybe doing ups, but with the opposite hip on the downbeat, okay? Which, in its most functional basic form, is what a down is, but let's not go there, okay? We're not going to discuss rhythm and timing yet. We're going to talk about the basic mechanics of the movement. So, in order to do that really pronounced down, what's going to happen is you're going to do a hip slide slightly out to the right. Now, not a full way out here, okay, because you're going to hurt yourself if you do that. You just want to slide out just a little bit off of center. Then release that hip. Okay, release that oblique, let that leg bend more. Bring it back to center. Slide over to the left. This is my left. Okay, drop it, bring it back up. Slide, drop, up, slide, drop, up, slide, drop, up, slide, drop, up. Okay, slide, drop, neutral, I should say. Slide, drop, neutral, slide, drop, neutral. Okay, really important, as always, keep that tuck in your pelvis, because if you do that slide and then that down, you're going to get some weird crunchiness back here, okay, and you should not feel that. So, at speed, smooth that slide with that knee drop, smooth it all into one movement, okay, slide, and as you're sliding, drop that knee and release the oblique at the same time. Slide, drop, slide, drop, slide, drop, slide, drop. Now you might notice that this is part of a Maya. Down figure 8 we do? Yeah. Okay. It's just a piece of that Maya. Okay? It's all connected, see? So, slide, down, slide, down, slide, down, slide, down. What you want to watch is that when you come out and down, and then back up, that you're not coming up into it up. Okay? You're not coming all the way up, you're coming just back to neutral, just back to where your pelvis and your hip bones are in line with one another. Okay? Let's go back and try that basic, simple down, okay? With just from ups. We're gonna go up, neutral, down, neutral. We're gonna do it on one side first, okay? So on my right, your left, if you're facing me, go up, neutral, down, neutral, up, neutral, down, neutral, up, neutral, down, neutral, up, neutral, down, neutral, up, neutral, down, neutral. On my left, your right, down, neutral, up, neutral, down, neutral, neutral, down, neutral, up, neutral, down, neutral, up, neutral, down, neutral, up, neutral. Left is my great side. Neutral, down, neutral, up, neutral, down, neutral. Now you'll notice that the opposite hip bone does go up and down, okay, because your pelvis is pretty much one unit. If you do something to one side, it's going to happen to the other. The opposite thing's going to happen to the other side because they're attached. That's okay. What you want to happen, the thing downs and ups, is that where you emphasize the movement, which side you emphasize is the side that people are going to look at. All right? So now, let's just do right down. This is a basic down. 1, 2, 3, 4. Release the oblique. 5. Release the oblique. 6, 7, 8. Down. Neutral to down on the other side. 1, 2, 3, 4, 5, 6, 7, 8. Okay? Now let's alternate. Down, neutral, 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 down, neutral. Now, I'm not going to go any faster than that because I want you to get that and get it so that you don't have to think about it before you start speeding it up, okay? Once you do that, then you can do it in more speeds. Down, 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 down. Okay, you can even do it fast if you want, although shimmies are normally done kind of on the up, they're not really done on the down.